Decongestants, so from the name itself, right, it prevents or stops congestion. So this decreases swelling of blood vessels in the nose or sinuses, therefore decreasing congestion. So it shrinks the engorged nasal mucous membranes and then relieves the sensation of stuffiness or nasal stuffiness. It can be oral or inhaled. The therapeutic effect is decrease in nasal or sinus congestion, and indications for this drug would be allergies, sinusitis, and common cold. Some precautions, definitely with patients with hypertension, it does cause narrowing of blood vessels, right? Because as a decongestion, it constricts the vessels. So for somebody with hypertension, it can actually make their blood pressure higher than what it already is. And also for patients with heart diseases, with dysrhythmias, again, this affects the vascular system. So we need to take precaution when giving it to patients with those conditions. Now, contraindications would include uncontrolled hypertension. So, if somebody's already on a ton of antihypertensive medications, and if we have to decide whether to give this medication to them, we want to take that in consideration. And so, if it's uncontrolled, definitely avoid these medications. Another contraindication is possibly heart disease and some dysrhythmia. So, a lot of the times, it is also case by case basis, depending on the severity and also depending on the provider. Some side effects include nervousness and insomnia. Again, it can raise the blood pressure, so it can cause some hypertension. If the patient doesn't have hypertension, they can develop hypertension if they're on these medications. And then it can also cause some palpitation. On the nasal route, although it helps with the congestion, a side effect that often patients will complain about is dryness of the mucous membrane, and something to be concerned about is rebound vasodilation. So that's the reason why we don't want the patients to be on this for such a long time, because once they stop it, they have a rebound vasodilation causing more congestion once they stop it, and sometimes even worse. So it makes it difficult for patients to stop using the nasal decongestants. This cycle causes some overuse and dependence of these inhaled decongestants. Also, for oral route, it definitely helps prevent that rebound congestion. But you see that a lot. A lot of patients don't even read the labels, because a lot of the times these medications can be bought over the counter. So you can encounter some patients who are on this medication chronically, long term, because they're so dependent on them. And so whenever they stop it, they have a very hard time. So they end up going back on nasal decongestants. So please remember that, and it's also something that you want to educate your patients about. So some nursing actions, again, monitoring for therapeutic and side effects, monitor for blood pressure, right? Because if we know that this can increase blood pressure, then we want to know what's the patient blood pressure maybe before and after administering, and also assessment of the nasal mucosa, again, for possible excessive dryness. Patient education part, we need to educate the patients regarding like the correct use, the frequency, the duration, the dose, and also it is important to let them know about the potential rebound effects, so they don't think that they're getting worse again or they're getting sick again just because when they stop the medication, they start feeling congested again. Let them know that that can be expected sometimes, but it's also important to, if possible, just get through that rebound congestion phase. Oftentimes, that should go away once the body gets used to not receiving that medication anymore. So some examples of drugs in this class. So oral, you have Sudafed or pseudoephedrine. It has some adrenergic effects, which constricts the vessels, therefore causing decrease in congestion. Then there's inhaled or nasal decongestants. One of the more commonly prescribed and used is the Afrin or oxymetazoline, which again has adrenergic effects, epinephrine, norepinephrine neurotransmitters, which constricts the vessels. There's also Flonase or Veramist. fluticasone propionate. This one is more of a steroid, and it works by decreasing the inflammatory response. And we have Nasonex or mometasone. There's also neosynephrine or phenylephrine, which again, same thing as the epinephrine. It does constrict the vessels, which helps reduce the congestion. And also rhinocort or budesonide. So if you can see, a lot of these inhaled medications are either a steroid or some sort of epinephrine or epinephrine neurotransmitter medications. So obviously the epinephrine and norepinephrine medications are the ones that will likely affect the blood pressure. So the ones that are in the asterisk are the ones that you need to know. But I just wanted to point out that Flonase, Nasonex, Flonase or fluticasone propionate, Nasonex or mometasone, and Rhinocort or budesonide are inhaled corticosteroids used as decongestants.